Lower House of Parliament approves $54 million supplementary appropriations bill. We'll have details to this story and more in the National Report. With the details to the news for Friday, September 3rd, I am Rikisha St. Louis. Members of the Lower House of Parliament approved a supplementary appropriations bill of $54 million on Friday, and the funds will be assigned to 5 different ministries. The Ministry of Finance, Economic and Physical Development, Public Utilities and Energy will be receiving the largest allocation of $2 million for recurrent expenditure and $36,434,719 for capital expenditure. In total, the sum allocated to the Ministry of Finance will be $38,434,719. Also set to receive an injection of funds are the Ministry of Health and Social Security, and the amount will be $10,204,000. The Ministry of Education, Human Resource Development, Religious Affairs and Information will be receiving $5,171,722, while the Ministry of Agriculture, Lands and Forestry will be receiving an additional $100,000. The Ministry of National Security will receive $1 million for the police. The Supplementary Appropriations Bill 2021 was presented to the House by Leader of Government Business, Honorable Gregory Bowen. He said performance of the National Transformational Fund has not met expectations, and revenues and grants for the first 6 months of 2021 fell behind target by $31.1 million. Currently, government is spending more than is being earned and is constantly making use of funds in its reserves.
For the year thus far, government is spending on average $10.6 million more than it collected in receipts. $60 million expenditure more than receipt. Notwithstanding, Mr. Speaker, the government has met all its commitment during 2020, even during the lockdown period, and in 2021 so far. Mr. Speaker, when you spend more than what's coming into the purse, this can only be done through a combination of removing from the reserves and increasing our debt to GDP ratio.
The money will also cater to COVID-19 loan support to the Grenada Airports Authority and the G-Cruise project, among others.
License fee due for Education Management Information System. Remember, Mr. Speaker, we had to move from the traditional face-to-face educational system to virtual educational system, Mr. Speaker. And we pay fees every year, $409,210 for such a fee, Mr. Speaker. The global partnership in education, again, having to do with the virtual and online progress made by the Ministry of Education, $409,000. Then the Ministry of Health, you see $2 million there, Mr. Speaker, to get additional equipment. Is small, and what we're facing there, we know we have to cut and contrive from other ministries to ensure that health has its budget, all to do with the COVID response. $204,000 for the vaccination campaign. We might say it's small, because we have to step up our vaccination program, Mr. Speaker.
Ministers Clarice Modest Kerwin and Oliver Joseph stood in support of the bill. They both commended the government and the team at the Ministry of Finance for the commitment to focus on saving livelihoods and investing in skills and capacity development during the pandemic.
We know what is happening. There might have been some errors in the first distribution, but the good thing is that it was caught up and it was remedied. But the better thing is that most people who were out of jobs, especially in the tourism sector, had, and I know because we have our records, Mr. Speaker, and it did give support to a lot of those people who otherwise would have been destitute. And so I believe they needed a stimulus. It's good to invest in infrastructure, in bricks and stone and whatever, but it's so much more important to invest in people and to give us a sense of buoyancy in such a difficult time.
In a pandemic, where we projected that the recurrent revenue, and it's very simple where government revenue comes from. It's no magic. 51% of the revenue comes from international trade or taxes on the border, on the port. The other 49 are collected locally. So if you have a situation where businesses are closing, hotels close, you will collect less income tax from workers because they're home, because unemployment increased. You will collect less corporate income tax from businesses because they are not performing at the same level as 2019. And therefore it's obvious that government's recurrent revenue will drop, will fall. And in a pandemic, this government still pays a 4% increase.
On Wednesday, the government launched the second COVID-19 economic stimulus package, which will see over $36 million distributed among sectors to provide relief during the pandemic. The stimulus program will run from September to December. Health and Social Security Minister Honorable Nicholas Steele says government remains committed to maintain control of the escalating COVID-19 situation. On Friday, during a sitting of the House of Representatives, Minister Steele announced that 3 Grenadians are in critical condition in the COVID-19 intensive care unit at the General Hospital. The Ministry of Health on Thursday recorded 153 new cases of the virus, bringing the total number of active cases to 599, of which 590 are local.
We have 6 individuals who are in our ICU at the General Hospital, or COVID ICU. The information I received from the doctors there is that 3 of those individuals are in a critical condition. Of the 6 individuals, 1 of those individuals is a middle-aged female who is pregnant.
The health minister encouraged Grenadians to keep safe and follow the protocols in place by the health authorities. The ministry will be conducting free COVID-19 testing and vaccination at Grenville Car Park and the Spiceland Mall parking lot on Saturday, September 4th from 12 noon to 4 p.m. and 1 p.m. to 6 p.m. respectively. Continuing the news, a 72-year-old woman from St. Patrick has become Grenada's 5th COVID-19 victim. The woman, who suffered from pre-existing conditions, was admitted to the General Hospital in St. George's in critical condition on August 28th. She is now the 4th person to die of COVID-19 for this week. The first person, a male, died in January. The Ministry of Health and, by extension, the Government of Grenada extends condolences to the family and friends of the deceased and continue to encourage the population to follow the recommended protocols in place to safeguard themselves. This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787 or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. General Practitioner Dr. Terence Marichal calls on Grenadians to focus on the severity of COVID-19 and take the necessary steps to keep safe. Dr. Marichal believes the noise within the public domain on whether the rapid or PCR tests conducted by health officials are accurate enough to differentiate between the annual common cold and COVID-19 should not be the focus at this time. During an exclusive interview with GIS, he said Grenada is capable of testing to rule out the common cold from COVID-19. However, the best way to eliminate doubt and fear is to get tested.
There is, in this moment, a crisis that we are facing, which is the COVID crisis. We have seen an alarming increase in the number of cases of COVID at this time. The only way we are going to know for sure is through testing. Many of the symptoms are very, very similar. What COVID does is give you flu-like symptoms. It gives you fever, gives you headache, it gives you body pains. The same thing can be applied to the flu. The flu gives you the same thing. The only time you're going to really know is if you can differentiate one from the other.
The medical practitioner said the variant that Grenada is now exposed to is not one to be taken lightly. He's concerned about the laid-back attitude being displayed by many during this period.
People need to get themselves tested in this time to ensure that it is not COVID and it is the flu. The increase we are seeing right now ought to be concerning to just about everybody, because we're not talking about a simple increase in cases, we're talking about an exponential increase in cases, which have been detected. We are capable of providing tests and doing testing to ensure and to confirm that what we are dealing with is COVID versus the flu. And what we have been seeing in the last couple of days, not only an increase in the number of COVID cases in the country, which right now is an astronomical over 400, but we are also seeing deaths taking place. We are now up to number 4.
Dr. Marichal encouraged Grenadians to follow protocols in place to curb the further spread of the virus.
In the meantime, all of the hygienic measures that you need to take, all of the protocol that has been established already, washing your hands, wearing your face mask, physical distancing, all of these things, sanitizing regularly, all of these are things that you need to continue to do, whether it is the flu or whether it is COVID. Drink a lot of fluids. If you have headache, fever, and those kinds of things, you take your regular Panadol or ibuprofen, whatever it is that would relieve it for you, and make sure that you do that test to differentiate whether it is COVID or the flu.
Finally, in the news, Dr. Taisha Donald, Director of Medical Services, confirmed the availability of beds at the General Hospital to house COVID-19 patients in the case of an outbreak. 11 beds are available to patients at the General Hospital and 13 beds are in stock in the event there is need for more. Dr. Donald also highlighted the availability of supplies that will aid in the effective care of patients.
In terms of ventilators, we have 18 ventilators currently at the hospital, and in storage, we have a further 10 ventilators. So a total of 28 ventilators on island in the event that it is needed. Based on our current headcount at the isolation unit, we currently have enough supplies to take care of these patients and to take care of our staff. Because like with any disaster, one of the things we always stress is ensuring that we take care of ourselves before we take care of others. So our staff is well taken care of.
That story just ended the national report for Friday, September 3rd, recapping the top story. Lower House of Parliament approves $54 million supplementary appropriations bill. On behalf of the entire news and production team, I am Rikisha St. Louis saying thank you for joining us. Until next time.